Okay. Hello everyone. Can you all listen to me, see me fine? Actually, my only app was not opening up. There was some technical problem. Yeah. Okay. So everybody's here. Everybody's here. Hi. You all are here. If you all are here, give me a thumbs up. I'll wait for a minute before we start. Can you hear me fine? Can you see me fine? Audio video is okay. Hi, good evening. Everybody here? Should we start? It would be really helpful if you guys can just give me a thumbs up so that I know that most of you have made it to this room. And then we will start with a quick session. Hi Ankush. Okay, so I'm Dr. Anshul Divakar and I welcome you all to the career counseling session for anesthesia. First of all, heartiest congratulations to everyone who has got a rank. I know this is a tough time and it is actually tougher than preparing because preparation was something that was in the dark. You were preparing for the best, but now everything is in front of you. Everything has seen the light. And now decision making becomes very difficult because everyone feels that this is the decision of their life and this is going to decide whether they are going to be happy or they are going to be unhappy or they are going to be rich or they are going to be poor, they are going to be respected or they are going to be not respected, and they are going to be livid or they are going to be just dead like anything, or they are going to enjoy their life or they are just going to sulk in a corner of their room and just keep on crying about everything. But trust me, this is nothing like that. Whatever happens to you in life is eventually going to happen. Your branch is just a rider that will take you to another step in your career, in your professional life. But it is my personal experience after being a postgraduate for now 5 complete years, practicing professionally, teaching professionally for 5 years. So nothing is going to change the way your life is going to fare. And this I speak on my experience of last 5 years being in professional life, 5 years of teaching, doing post graduation for 4 years, living in different parts of the country, meeting different students, working with different kind of surgeons, working with the best surgeons in India, working with surgeons who are barely qualified to be called as surgeons, and working as a teacher, as a professional teacher, learning as much as I can tell you nothing in your life changes with your branch. Only thing is it changes is your perspective towards your life. So do not pressurize yourself into thinking that whatever decision you are going to take in this career counseling session, in this counseling process of yours, the post graduation that you are going to choose is going to change anything in your life. Whatever is going to happen is eventually going to happen, whether you are a radiologist or you are an anesthesiologist or you are a pathologist or you are an anatomist. Doesn't make a difference. If you want to be happy, happiness is a personal choice. And I strongly believe in that because happiness comes from inside. Happiness is when you feel it and it is not something that is related to your branch. Okay. And this is something that I want to begin this session with. I have this strong feeling and I strongly believe in this fact, in this statement that I'm going to tell you, that no branch is superior or inferior to anyone. And I don't talk about this because you will say, sir, grapes are sour. You didn't get a branch that you wanted, so you ended up in anesthesia. So now you're saying every branch is equal. It's not like that. See, an anesthesiologist works with every specialty in the hospital. And we are the people who are most exposed to all these specialties. Like a pediatrician never goes on to a medicine ward to see an adult patient. He has no work in surgery department. He has work in pediatric department, max to max OBG department and radiology department. But we as anesthetists, we work all around the hospital. We are everywhere. And so I know about every specialty, their working, their hardships, their failures, their successes, their happiness, everything about every specialty, right from the non-clinical branches to paraclinical branches to preclinical branches to clinical branches. And I can tell you that no branch is inferior or superior to anyone. Everybody is working together for the benefit of the patient. So nobody is absolute and nobody should be considered above or below anyone. And I have strongly believed in that if you are good, if you are true to what you are doing, if you have the capability of being the best in what you are, then everybody will respect you. I, as an anesthesiologist, I work all through the town. I work with 15, 16 different types of surgeons. I work all types of cases and I get respect from all of them because I give them respect. I don't treat them as somebody who is trying to exploit me, and they don't treat me with somebody who is just coming and doing a job and so they are employing me. So it is the mutual respect that takes you forward, and it is the happiness that you get out of your work. Some people's job is to come, do their job, give anesthesia, go. Some people have to sit in OPD and listen to the patient. Somebody has to hold hand. The nurses, they come and they give medications that makes patient better. So everybody has a role to play. So we can't consider that, okay, sir, we are not in patient interacting branch. We are like this, we are like that. So it is all about trying to find the fallacies of what you have. I'm sure most of you, if you would have gotten the top 1000 or top 100 rank, you would have never said that, sir, there is no patient interaction in radiology. What patient interaction does radiology do? When you come to a radiologist, in fact, except for ultrasonography, you don't meet your radiologist at all. And in a busy center where the sonologist is very good, they don't talk to the patient. The patient comes, they lie down, they see what USG has to be done. They put the probe, do the USG, give the report, and that's it. But when there is radiology, somehow everybody is okay with being non-clinical, rather non-patient interacting. But somehow when it is anesthesia or somehow when it is any other specialty which you think that is inferior, you start feeling that, okay, it has this problem, it has that problem. Every branch has some things that it doesn't have and something that it has. No branch can be called as complete. And you cannot talk in terms of dependence because everybody is codependent. Without an anesthesiologist, you can't do an LSCS. Without an obstetrician, you can't have an obstetric patient. But without a patient, nobody is doing anything. So ultimately, we are all dependent on patients. So if you say, sir, ye dependent hai, wo dependent hai, aisa nahi hai beta. Even if you become an orthopedician or you become a surgeon, ultimately you are dependent on your patients. If you don't get patients, then you are as good as doing nothing. Doesn't matter how much you have studied and how much good rank you have got in your exam. So this is something that I wanted to talk about before I started this session, because I get this question a lot more than other people. Because of the ranks that you have, you feel that you are getting trapped in choosing anesthesia. Don't fall into that trap. Don't choose anesthesia as a trap. Listen to what I am trying to say. Assess all the factors that are there with anesthesia. Whatever lacunas anesthesia has, accept them. If you are in a state to accept this branch for what it is, you will be the happiest person in the world, like I am. I am a happy anesthesiologist. I am known in my town as a happy anesthesiologist. I have two passions in life, reading and giving anesthesia. I do giving anesthesia 5 days in a week. I read and I teach 2 days in a week. I am the happiest person in the world. Never for a second have I thought, what if I would have been another branch? Because I don't know, I would have had this balance in my life in terms of academics and working, and the immense satisfaction that you get after doing a case, and that instant gratification that an anesthetist gets, Nobody else gets it, because we go, the patient is in lot of pain, the patient is anxious, there's a surgery, we go, we relieve their pain, we make them anesthetized, and at the end of the surgery we make their job well done. They are out of the anesthesia, out of danger, everybody is happy, patient is happy, surgeon is happy, anesthetist is happy. So it is a very instantly gratifying branch, and if you want to feel happy in it, then only you will feel happy in it, because otherwise you see there are a lot of students who have taken up anesthesia, they feel trapped, they feel it is boring, they feel it's always in the theater, they feel they have to wear loose scrubs, they feel that the life inside theater is very boring, because they are boring people. They don't want to accept anesthesia for what branch it is. They don't want to seek the knowledge and the thrill of human physiology, but they only want to compare themselves with other people's life and then feel bad about themselves. You can't really treat those people, because this will happen in every branch that they take. Doesn't matter whether it is anesthesia, pathology or dermatology. Having said this, let me come to the point that we are here. We are here for career counseling session. I will be giving you a broad perspective about anesthesia. And when I say broad because it is something that is my experience plus the experience of few people around me. So I'll give you both pros and cons of anesthesia, but I cannot tell or predict how would you feel in anesthesia. So that is something that you have to judge yourself based on your personality and the kind of work that anesthesia demands. So let's come to pros of MD or diploma or doing a post graduation in the subject of anesthesiology. First of all, it's a clinical branch. Lot of interventions. You do lot of things. You take IV lines, you give spinals, you give GA, you deal with a lot of drugs. You are involved in the active decision making, intraoperative hemodynamics, vitals, patient's outcome, preoperative history taking. So you are intently with the patient during the period of those 4, 5 hours, 6 hours that you are there for the perioperative period. And that gives you a lot of clinical knowledge, and you are somebody who is highly well read in the circuit of medical sciences, because you know about everything. Because an anesthetist, he does an obstetric case, he does an ENT case, he does an ortho case, he does an ophthalmic case, he does a surgery case, he does a neuro case, cardiac case, pediatric case. Every specialty that is practicing clinical in a hospital has to deal with an anesthetist, and therefore anesthetist needs to know everything about what they are doing, because we are in the business of making their job easy. So we are highly clinical and knowledgeable people in the hospital. Second is something that people keep asking me, sir, kaisa hoga, kya hoga? There are so many seats of anesthesia. So there is an easy settlement. There is no issue of jobs, precisely because the number of anesthetists in every medical college is 1/3 of the number of surgical branches. What happens is you compare MS surgery versus anesthesia. So if there are 30 seats in surgery and there are 40 seats in anesthesia, you feel that there is surplus of an anesthesiologist. But think of it. There are 30 seats of surgery, then there are 10 seats of orthopedics, then there are at least 30 seats of OBG, then there are 7-8 seats of ENT, then there are 10 seats of ophthalmology, then there are later on there are at least 5 seats for neurosurgery, pediatric surgery, cardiac surgery, urosurgery, neurosurgery, whatever it is. So if you calculate the total number of surgical branches, surgical seats versus anesthesia is still 40. So you are always in demand, because that is what the society is producing. We are producing 1/3 anesthetist as compared to a surgeon, right? Easy learning curve. Anesthesia post graduation is very easy. In the first 6 months, you learn almost everything that is there to learn procedure wise. And the next 1.5 years in the OT, you hone the skills and you try to make the best of what is being offered to you. In terms of better opportunities for females, it has fixed job opportunities later on when you take a job, less laborious work. You don't have to run here and there. You go and work in a chilled OT environment. That is a chilled environment. You know, OT is the most cleanest place in the world, as well as it is very cool. So no matter outside temperatures 41, 42, 43 degrees Celsius, you are not sitting in wards and writing notes and taking rounds while you are sweating. You go, you change in your scrubs. Scrubs are the most comfortable piece of clothing in the world. And then you reach the theater and you work in a 16, 17, 18 degree environment. So it is very less laborious work. Better timings in institutional practice. When you have joined a job, then you have a fixed 8-hour, 10-hour job, few emergencies, but most of the time post call off. So that is something that works better for females. And when I say females, I'm not considering them as somebody who can't do work, but somebody who has to think of a future family. So it becomes easier for them to plan those things ahead when they get married and they want to have kids. So they work till the 9 months of age, then they go on the leave, they come back and immediately start working, because it is very less laborious work. So even in the postpartum period, they easily happen to work. It has everything in it. If you want to do anesthesia, MD anesthesia is enough. But if you want to do super specialty, we have neuro, cardiac, pediatric, regional, onco, obstetric, difficult airway, pain management, innumerable number of branches that you can do specialization in. You have all the types of options. You have DM, DNB, that is for 3 years, fellowships for 1 or 2 years, sometimes observerships. End branch, if you don't want to do anything ahead, then this is it. You are well equipped to start your practice. Like me, I have not done any fellowship or observership. I am simply DA, DNB anesthesia. Always and always in demand. I told you we are always in demand because 1/3 the number. Immediately start working after post graduation, which happens rarely with other specialties because they don't learn the very specific skills during their residency. So they have to give 2, 3, 4 years after their post graduation or super specialty, especially in surgical branches. But as an anesthetist, the day you pass out of your PG, and in most states, you don't even have to pass your PG, you start working outside from second year of your post graduation. You can settle in any city in India you like, whether it is a tehsil place or it is a super corporate hospital in a big city. Everywhere there is a job of anesthetist. But a pediatric surgeon cannot come to a district place. He need to be somewhere that has a load, that has an awareness where pediatric surgery can be done, right? So this is something that works best for people who don't know where their future is, who are belonging to small town and they intend to go and settle in small towns like me. I live in a very small town. There are 15 hospitals here. All 15 hospitals I cater. I am always busy at work and I'm very happy because this is the place I wanted to settle. But had I become a neurosurgeon, I don't think I'll be able to settle in the city because I would not get that kind of work here. So I would have to be forced to be settled in a big city. So for all those people who don't have this thing that I have to only settle in a big city, for them anesthesia is a very good choice. Best combination of personal and professional life. See, the best part about being an anesthetist is no patient interaction, no relationship with patient. I consider it a boon because at the end of the day, when my job is done, I come back home and I don't have to think about my patient. I don't have to take rounds 2 times in a day, even if it is my off day. If it is my off day, I don't get out of my house. If it is my post call off or if it's a Sunday, I don't have this thing that I have to go out of the house and take rounds. Later on in life, these things do matter. This is something that I love. For other people, I don't know what they want, but this is something. So it gives you a very good combination of personal and professional life. When you are at work, you are intently at work, but when you are out of your work, then all your time is your personal time. And last, it is an easiest branch to become an entrepreneur. Most of the combination hospitals, the hospitals which are owned by multiple people, they keep an anesthetist. One, they get always free access to anesthesia. Second, they can easily manage the hospital because they don't have to look after OPDs. They don't have to go and sit in OPDs and see patients. So during that time, they can easily manage the hospital. Most of the managerial post or the academic post in any hospital are managed by anesthetist only. Okay. But like every other branch, this is also not without its cons. So let's start with cons. So the most common question that you'd come to your mind is that it's a dependent branch. Yes, everybody is dependent. If you want to consider anesthesia as dependent to surgery, then you have to consider surgeon as dependent on anesthesia. My surgeons wait for me when I am busy. I wait for them when they have to post a case at a certain time. Every day we try and make a balance where we want that both should be happy. So if the surgeon wants to start at 6 a.m. and you don't want to get up at 6 a.m., then you have to refuse the case. But in clinical practice, you don't refuse a case because if the surgeon gets a patient at 6 a.m., he doesn't refuse a patient. You're getting my point? We are catering to surgeons. We are not catering to patients. So sometimes your surgeons want to start early. You have to start early. If you consider that as being dependent on someone else, then anesthesia is not the branch for you. But how does it make a difference? Everybody has to adjust for other people. When you are a surgeon, if suppose a patient comes to you at 11 p.m. in the night with acute abdomen, you are a surgeon, you can't say no. But an anesthetist can refuse a laparotomy at night by not picking up the phone. So everybody is dependent on another person. So yes, if you consider this as dependency, then it's a big con in anesthesia. Yes, your work timings are decided by surgeons' work timings because they are the people who manage the hospitals. They are the people who are calling you for work. So whatever time it suits them or their OPDs or their work culture, their work pattern, their preferences, something that you have to adjust to. And as an anesthetist, you become very adjustable in life. Like I start my day at 5:30, 5:45 in the morning. I have 3 sets of surgeons, one who wants to operate in the morning, one afternoon, one evening. I work with one group of surgeons in the morning, one in the afternoon, one in the evening. I start my day at 5:45, 5:30. And I end it usually around 9 o'clock, and I'm super happy at the end of the day because I've done a lot of work. So this is something that you have to adjust to. Less recognition amongst patients and more among surgeons. Yes, definitely that is a big con. If you are in a town, even if you are working for 20 years, there will be hardly 200, 300 people who will recognize you, who would have been anesthetized by you. But otherwise people will just know you कि हाँ वो बेहोशी का doctor है. So if that affects you, yes, that is a big con. Limited income. When I say limited income means whatever you work for is what you earn for. You don't get anything extra as kickbacks, like you don't get OPDs, so there is no OPD charge. There are no separate procedural charges. Whatever is there, it's part of your anesthesia. There are no pharmacy charges. There are nothing kickbacks that are given to you because anesthetic drugs are very limited and they are controlled by the government. So there is nothing much that you can do about it. So yes, there is no other things that are coming as an income. You don't get to treat normal people, so you will get a feeling of incomplete as a doctor because you will not have an OPD. So some of your friend, if they have a problem, they might consult you, but basically you are never treating them. They are getting treated by other physicians or surgeons. So yes, you do get a feeling that I am not a complete doctor. Highest litigation chances. Yes, this is a credible problem with anesthesia because anesthesia is an emergency oriented bus. You are dealing with life and death. So yes, litigation chances are higher, and therefore we take a huge indemnity insurance. I have a 2 crore indemnity insurance that covers everything left, right, center. So I work independently. I'm a freelancer. So freelancers are at highest risk. There is no institution. But then almost everybody has some or the other risk. Surgeons have the risk of complications under surgery. Radiologists have risk from reporting. So if you are working, then you will have complications. If you have complications, then you are bound to have litigations. It's an emergency oriented branch, at least for the first 5-7 years of your life. So life is going to be hectic. There will be days and you'll be working in the day, then afternoon, then night, and then off. So that is a part of anesthesia. You can't avoid emergency when you're working in anesthesia unless and until you take a super specialization where there are no emergencies, something like, neuro anesthesia where more or less there are no emergencies, or if there are actually decompressive craniotomies. But yeah, you can't really avoid emergencies in anesthesia altogether. Remuneration appears less in long term. What happens is that people don't compare what they are earning immediately after doing their MD with the respective surgeon who has just passed out, but what they do is they start comparing with the surgeon who has established practice of 10-15 years. Once a surgeon establishes his practice is not a factor of time, it is a factor of his skill. So for the same procedure he can charge 4 times extra and people will give him, while you can't charge 4 times extra even if you are 20 years old, right? So what happens is people start compare their current salary with somebody who is 15 years ahead to them. So yes, in long term, it does appear that the person is earning less. Income is always proportional to the number of hours you work, and the number of hours are fixed in a day. So your income cannot go beyond a certain point. So there is always definitely a stasis to the amount that you are earning. Some people have this feeling of boredom, that is same procedure, same things, everything same. That is a person problem, not per se an anesthesia problem. It can happen even to a radiologist. Saturation is in higher positions in corporate hospitals in big cities is a problem. Yes, that is a definitive problem because anesthesia is not a very laborious work. So people keep on working till they are 70, 75 years of age. So they don't leave the top post. Because they don't leave the top post, so people are not getting promoted. So if you are thinking of working in a corporate hospital, then the journey is going to be long, but ultimately you'll reach there. Okay. You guys are here because this is the first time I'm taking a career counseling session and there is absolute silence. How many of you are actually listening to it, or am I just recording it for the future reference? Okay. Very good. Perfect. Next, let's come to the common question कि sir DNB करना चाहिए कि नहीं करना चाहिए. So let's look at pros and cons of DNB. I am a DA DNB, so I have seen both the parts of the world. I have seen government college, I have seen DNB institute. So pros of DNB, definitely no bond, which is a big thing these days, because unnecessarily you have to spend 1, 2, 3, 10 years doing bond or thinking about bond. Working in corporate hospitals gives you an environment which is rich of all equipments and modern technology. So you name it and they have it. So that is the best part about working in a corporate hospital. Better exposure to super specialty because they work in a coordinated manner and they have everything in one place. And robust training in terms of variety of cases and management. This is not true for all DNB institutes, but certain premier DNB institutes. Okay. All right. Cons is no independent work. It is mostly supervised because a corporate setup, people are paying huge amounts of money to get anesthesia. So don't expect somebody will tell you, okay, ja wo case induce kar de ya wo case manage kar de. Aisa nahi hota. 3 years you work under supervision. They give you lot of hands, free hands, but there is always somebody standing by the side of you. And trust me, in the first 3 years when you are doing your residency, you want people to stand by your side. Otherwise you will make a mistake. And when an anesthetist makes a mistake, it is usually fatal for the patient. So we also want that the first 3-4 years should be something that should be very, very supervised. Academics is not so good as government hospitals because usually people are very involved in their work. They are all private practicing consultants, so they are very driven. So they teach less, and whatever they teach is bedside teaching, OT table side teaching, and less of academics in terms of seminars. Long working hours of the corporate hospital is something that is a pain, but that is also there in first year MD. But from second year MD, your working hours become significantly less, but in corporate hospitals usually you have to work a lot. Smaller institutes do not provide any advantage of either academics or clinical exposure, so avoid taking DNB in very small hospitals. And there is all-time disparity between MD and DNB, but that is only relevant for people who are wanting to work later on in a medical college. For them, yes, MD DNB does make a difference, but apart from that, nowhere else people differentiate about MD and DNB. Okay. Let's talk about diploma, and most of the diplomas are now been taken back, but now NBE has introduced their own diploma. I'm not sure about NBE diploma. You get it at 50,000, 55,000 rank. This is the first time they have introduced this. I don't know how they are going to manage. They are in very, very small hospitals. What would be the level of training there? Who would monitor that training? I have no clue. So NBE diploma is something I cannot comment unless they have few batches that have passed out. And then we get to know, okay, this is the pattern and this is how people have studied and stuff like that. But for diploma, which I have done, right, NBE diploma is something I can't comment about, but diploma I can definitely say because I am a diploma holder, and the pros is it's a short course, cute 2-year course. First year, you just work. You reach in second year, suddenly you start getting independent cases, you study, pass exam, done. There is no lag. It's amazing actually. It's one of the most fun things that I've done in my life, 2 years of diploma. I simply worked, partied, studied, worked, partied, studied, and 2 years went by like that. Because you are getting a clinical seat at not so good rank is, I think, the biggest pro of being a diploma holder, because at that rank you cannot expect any other clinical branch and you are getting a clinical branch. Therefore, it's a God's grace that there is a diploma. Otherwise, I would have not become an anesthetist. Option of MD and secondary DNB later on so that you can become equivalent. So you can either appear NEET again or the PDCET again, and either you can do a secondary DNB like I did, or you can again do MD. A lot of people, they do that also. They again appear for DNB, and that is usually for 2 years. So post diploma MD or post diploma secondary DNB, both are of only 2 years. You can kickstart your private practice immediately because you are well trained. 2 years of diploma is enough to start basic practice, and later on with experience you can do any case you want. Easiest diploma branches to learn from. There are only 3 diplomas which are very, very good in terms of practice and learning. One is diploma radiology, second is diploma anesthesia, third is diploma obs gynec. All 3 of them are ruling the market right now. Most of the private people that you see who have big hospitals are all diplomas. Because they didn't get entry into medical college, they didn't get up caught up with super specialty and SRship. Therefore, they immediately came to practice, and then they built a big hospital and they started working. And now 10-15 years down the line, nobody is asking them whether they're diploma or DNB. But cons is definitely it's not an MD. So it's not an ultimate degree. It's less of a degree. So yes, you have to adjust to that. Problems in getting a job in a medical college. There are no SR post for a diploma holder. You only get a JR post. No consultant post in corporate. If you are plain diploma, no corporate is going to give you a consultant post. You are not even eligible for most fellowships and DM courses. So future education is also not possible. And you have to again prepare So 2 years you study anesthesia, you read anesthesia, then after the end of 2 years, you again have to study for an exam and then again give an exam, again enter DNB and then again at the end of, so there are too many exams in life if you take diploma. But that helped me. I wanted to become a teacher. I have given 3 exams. So I am more well read with most of my MD people who have given exam once and they have passed it. So I'm more knowledgeable. So I'm using that knowledge to my advantage. Okay. Let's talk about a very common question, sir. What about critical care? Critical care is a super specialty of medicine. Remember this thing. Most anesthetists are eligible to practice critical care. Either they are trained or not trained. An anesthetist is by default considered as an intensivist. You get a lot of intensive care, basic intensive care training during your post-graduation. If you want to pursue intensive care further, you have multiple options. You have DM courses for 3 years, DNB super specialty for 3 years. You have fellowships for 1 or 2 years. And you also have online critical care courses, something like what I have done. I'm a multiple diploma holder in online critical care courses. I have not done something directly in a hospital. Online critical care is also something that people do these days. Is it the only way that an anesthetist can become independent? No. Even if you are a critical care or intensivist, or unless until you open your own ICU setup, you are still working for someone else. Still somebody else is sending you patient, and critical care is a different kind of a job. It's not a job that is defined by time. It is defined by outcome. So if you have 10 patients in your ICU and 4 of them are very critical, then you have to treat them 24/7. You can't say, okay, my job is done. I came at 8 o'clock. I'm going at 4 o'clock. That is doing duty. If you are owning a hospital, if you are owning a critical care unit, you can't say I won't treat. And if you are the only intensivist in your critical care unit, then no matter what time of the day or night it is, you have to go and treat them. So don't consider it as the only way out from the dependency of anesthesia. Critical care specialists also have to work for someone, or they have to open their own ICU to become their boss. And trust me, if you are your own boss, and remember these lines that I'm going to say for life, if you are your own boss, you don't take leaves, you work all the time. Being your own boss is not something that is good for your personal life. It is good for your professional life. I am my own boss. I work more than most of the people who are working in a hospital, who have enrolled in a hospital, or because I'm not governed by timing. So I can work anytime I want. I just got I got 2 calls and it's 8:20. From 9 o'clock I have to again go for 3 cases. While I started working at 6 a.m. today. I finished at 12:30 last night. So when you are your own boss, you work more than what you think you would, because then there is nobody to control you. So you often feel that, okay, I might work today, I might not work tomorrow, but that tomorrow never really comes. Okay. Anesthesia, is it easy to settle abroad? Yes or no? Yes, if you are hardworking and you clear their exam. Everything is exam based, everything has a protocol, everything has a set of rules and requirements. If you do that properly, then yes, anesthesia is a very, very easy branch to settle abroad. No, if you feel that they'll simply call you, ki, okay, madam, you are an anesthetist, you come, you work in our country, it doesn't work like that. Every country has certain specific rules and regulations that you have to follow, clear their exams, get work ex, and then only you are eligible to work there. But yes, if you want to work as an anesthetist in Australia, New Zealand, UK, Dubai, and European countries like Germany, then yes, anesthesia does give you an option that you can go cross their system and become an anesthesiologist, something that is very difficult for surgeons because they usually don't let you operate. Okay. Now the big question, I always wanted to do radiology, but my rank is something that I can get only anesthesia. Will I be happy? I cannot guarantee that. Happiness is a matter of personal choice. Do not relate it to your branch. Your branch has minimally to do with whether you're going to be happy or not. I have seen sad radiologists. I have seen very happy pathologists in life. Okay. Certain questions that are asked to me most of the time. Just a minute. Okay. My rank is 20k onwards and it was my second, third attempt. Don't know what should I do. Should I prepare again or take a seat or prepare for mid-year exams? See, this is a personal choice and it is not dependent on whether or not you're getting anesthesia. It is all about your mental state. If you feel that if you work towards your goal and you can get a better rank, you sit and try for a better rank. If you feel you are exhausted, this is the end of the road in terms of preparation, which is a possibility. And I'm not judging you because I was a student like that. I got a rank which was not so good and I decided I don't want to further study. So I took up diploma anesthesia and then I never went back to thinking what would have happened. If you take 10 years of your time, you might top, but then you should be ready to give 10 years of your time. So you see your mental state. If you feel that you are able to give another attempt, then give it. Otherwise, take up a seat that you think that you can endure for next 35 years of life and be happy. Is MD better than DNB? Only in terms of getting medical college job. Otherwise, most of the MDs are equivalent to DNBs. What should be the order of MD, DNB, diploma? See, there are so many medical colleges and now there are so many online websites that give you detailed rank-wise distribution of these colleges. What I would suggest is that you see around your rank what colleges were being taken by students. You do your own analysis. Give me, if at all you have a doubt, send me a list of 5 or 7 medical colleges or DNB institutes. If I know about them, I will definitely get back to you on what should be the order. Should we opt for diploma from medical college or DNB in a private hospital? Again, it depends on the hospital. If you are getting a DNB, it's a 3-year course, finish it off. But if it is a very bad DNB institute, then prefer diploma. Should we go for diploma in clinical subject or MD in paraclinical, non-clinical? Matter of personal choice. Will it be difficult for me to adjust in new place, north to south or vice versa? Language will be barrier. See, these are the things which are commonly problem for most of the people. As a professional in anesthesia, we deal with these problems less because we talk to the patients very less. So if you learn basic language of that particular state that you are going, suppose a North Indian coming to South India or South Indian going to North India or people going to Northeast India, it will take 6 months of time to learn the local language. Once you learn it, then it becomes very, very easy. Is anesthesia saturated? I told you the ratio of 1:3. You only analyze, you go around in your town and ask, is anesthesia saturated, and get your right answer. MD anesthesia versus DNB anesthesia versus MD in a private college. Obviously, if you have money, go for private college. Don't take loan for MD anesthesia. That's a frank opinion. Don't take any loans. Okay. Don't buy a seat for 70-80 lakh rupees in anesthesia. Rather than go do a DNB and then go to a big medical college and do 1 year of SRship. You will earn also in SRship and you will learn also everything. Getting anesthesia in first attempt, what should I do? Drop or pursue? State of mind. You only know whether you have made the mistakes that you have made because you were ill prepared or something because you made a mistake in the exam itself. So, Kinal, this is for you. Do not take up a subject simply because you feel that this is the end of the road. I can't do this anymore. If you are a fresher, if you are getting a good anesthesia seat, you have been interested in anesthesia, you only take anesthesia. Otherwise, you can give yourself a fair shot and you can try and get a better rank in the next exam. Anesthesia for girls, I told you there is no problem. Legal troubles, again, every branch is associated with legal troubles, but yes, anesthesia is more. Emergency work, yes. ICU duties, yes. While you are making a decision, this is something that you should know. There are certain places in India where still there is no bond, which is a boon. So there's a bond, no bond in Shillong. Sorry, somebody sent me this list. They have written my alma mater. I am not from Shillong. So sorry for that. So this college in Shillong, central institutes like AIM, JIPMER, PGI, Delhi colleges, MAMC, UC, LHMC, RIMS, JINIM of Manipur, GMC Chandigarh and Haryana colleges are something that do not have a bond. So this is it from my side for career counseling in anesthesia. I hope I was able to answer all the questions that would have been in your mind. If there is anything else, I am sitting here and you can ask me anything you want. Pisin, what you are talking about is the top 3 medical colleges in India. So obviously it would be very bad of me if I try to choose between them. But if at all you want an order, MAMC, VMMC, Lady Hardinge. There is a video that has been uploaded in this channel called as Residency at Central Institute, Anesthesia Residency at Central Institute. Anybody who has a doubt regarding opting from AIMS, PGI, JIPMER, they can definitely go and check that video. It's a 45-minute an hour video. all the things will be clear to you regarding Central Institute counseling. Again, PDCD exam difficult as NEET PG. Every exam is difficult. If you are not able to clear it, every exam is easy if you are able to clear it. पढ़ाई करोगे तो क्लियर हो जाओगे तो इजी कहोगे, पढ़ाई नहीं करोगे तो क्लियर नहीं करोगे, डिफिकल्ट करोगे. एग्जाम की डिफिकल्टी और इजीनेस तो यार आउटकम पे होती है कि नहीं? What about settling in Dubai as anesthetist? What about it, Jyoti? Shreya, one of the best. DNB in Gangaram is one of the best. You can close your eyes and you can go and join the department. You will come out as one of the finest anesthesiologists in the country. I think, Piscine, I just told you everything about every country. If you want to go to UK, then you have a FRCA program, Fellowship of Royal College of Anesthetists. It takes around 2.5, 3 years to enter the program. It's a long course. You don't become a consultant straight away. It takes 7 to 8 years of time to be eligible for consultancy. You have to pass 3 exams. You have to work there for 18 months as an MTI trainee. And then only you are eligible for appearing for FRCA Part 2. After that only you can get a registration to even apply for a job there. There the pay is relatively better than here, but the kharcha are also there, so I'm not sure how much they save. But if you want to go to any other country, then anesthesia gives you plenty of options. And when the right time comes, when you are in your final year, then you can always find groups that help you in this regards, as well as you can Google the procedure. Everything is there on the internet. All of them are good. I would choose KEM over LTMC over grant. DA to DNB takes long time, so small institute DNB to SR in big college, is it a good choice? Not really. If you are doing small institute DNB, the academics might not be that good that you will pass the DNB in first attempt. If you don't pass the DNB in first attempt, there is no question of SR-ship, so you will wait for 6 months to pass DNB, then go for SR-ship where you will be a senior, you will be a DNB, but you will not know stuff. So it is better to have a DA from good college, then do DNB from good college and be good in everything, good in academics, good in work. Time is same only, na? 4 years it will take for DA DNB, 4.5 years, 4 years for this, what you are saying. Do primary DNB, 3.5 years, and then 1 year of SR-ship, so that is 4.5. और बोलो. Very beautiful, Pista. See, don't talk about the top colleges in any state. You also know BMC is the top college in Karnataka. How can you talk about top college in any state? It is the top college, right? So it is bound to be good in every specialty. That is why it is called as top college. MMC Mesu decent. See, please don't start asking about institutes here. We are wasting time. You can message me on Facebook Messenger. Make a list. And I'm telling you, I do not have specific idea about most institutes in India. What I get is a overall knowledge about how things are. So the best way of knowing about an institute is catching hold of a resident, and they will only tell you the internal working of the department. If you are only diploma, then yes, jobs are a problem for you. Usually they don't give jobs, consultancy posts to only diploma holders anymore. So you need to top it up with either MD or secondary DNB. That is a matter of personal choice, Jayashma. Level of training would not be too different. It is just where you want to spend the next 3 years of your life. No, that is fine, Keenal. See, perspective of people is not bad. You don't get a job as a diploma. I told you in the cons of diploma, right? It's a difficult to get corporate job or medical college job as a diploma because it's an inferior degree. There is no doubt there is an inferior degree. So you need to decide whether you want to pursue that or not. It has to be a very conscious decision. I chose that decision because I knew that I'm never going to do a government job. I have never applied for a government job. I have never, not even considered doing a job. I have always been a freelancer and I knew from beginning that I am going to be a freelancer. Piscine, just remember one thing, no doctor sleeps at the end of the day empty stomach. Have you ever seen a poor doctor in your life? Just think about it. Have you seen a poor doctor? What you are saying is that you are comparing your income to somebody else's income. But when you compare your income, you should also compare your investment, right? So let's take an example. 15 years from now, you are earning X and an orthopedic surgeon who has an orthopedic hospital is earning 10X. Okay. Now what you will say after 15 years? It was a mistake that I took anesthesia. See, I am earning 1/10 of him while I get to give him anesthesia and then only he can do all cases, right? This is what people do. But what they don't see is in the last 15 years, you have not invested a single penny towards your work while he has spent 10 crores of rupees to set up that hospital and a practice. So now when he is earning 10x of you, it is because he has invested 10 times more than you while you have not invested anything. An anesthetist does not even need to carry his own spinal needle. But if a patient goes to an orthopedic hospital, can the hospital owner say, I don't have the chisel, I don't have hammer, I don't have screw, I don't have siam? So it is all about your perspective of earning. As an anesthetist or any other specialty of medicine, you will never die of hunger, you will never die a poor man. You will always earn enough to not only support your own family, but 5 more families. That is the matter of fact. It is only your perspective. If you want to always keep comparing your earnings to other people's earnings, you are going to be sad irrespective of whether you become the second richest man in the world. Only the richest man in the world can say कि हाँ मेरे पास सबसे ज़्यादा पैसा है तो I am most happy. But even he is very tired because he wants to buy Twitter and nobody is letting him buy Twitter. So you are getting my point. Earning should be lesser of a criteria while you are trying to choose a field because earning depends on lot of other factors apart from your branch. No, Keenal, I am not able to understand. Anyway, Keenal, we will talk later on. We are not talking about taking a seat right now. You are a fresher. We want to do something else with you. So you don't ask too much about diplomas. You are welcome, beta. And this is a perspective I have gained over a lot of years. You see these hairs that I have lost? This is because of this perspective only. All the best, bacho. So everybody done? Is there any more doubts? I think only few people came. I was expecting actually more. But I think 7-8 only came. But it's okay. You can always watch these videos and definitely watch the video that I've put. This I've recorded last year with few of the DAM students who have taken up anesthesia residency in Central Institutes, and to hear their perspective, because I have not done anything in Central Institute, so I've always found that my opinion would not be that good. It would be just an speculation. So I brought them all together on a Zoom call. I recorded that thing and it is now for you. Okay. Okay, so there were a lot of people who were silently listening. So shall I hang up? You have the video. You can always talk to me on Facebook Messenger. That is the best way of finding me. If you have any doubts, you have queries, you have anything you want to ask me, just message me over there. It might take a day or two for me to reply because of my schedule, but I'll definitely reply. Okay. No, Saz, that is not my job. You go to last year's allotment list and see at 31K what all probable institutes you are getting, and then we'll talk which institute would be a good place to start diploma. I don't remember things rank wise. If you're getting an MD, then go for MD. Pratyusha, if you're getting an MD, go for MD. No doubt about it. In anesthesia, it doesn't really matter whether you're an MD for which place and DNB from which place. More or less, everybody gets to get to do all. Alright? Chalo. Really nice meeting you all, and see you soon. Okay?